First of all, location, да, such as one of the characteristic of the MI, it's location. We have 12 leads in ECG, да, by this ECG changes, да, by these leads we can tell about what wall is affected, да, and next moment you ought to understand by this wall, you will see, as example, here, да, here, we have inferior location of MI. In this situation, we can think what artery is blocked, right? It will be what artery?
Coronary.
Three of what of them? What of them? If we have MI in inferior wall, what artery is blocked?
Left circumflex artery.
Huh?
Left circumflex artery. Ascending artery.
Right coronary artery. It will be block of right coronary artery. Понятно? If MI localized here, it's left coronary artery. If MI localized here,
Circumflex.
circumflex artery. Понятно? By location of MI, when you will do angiography,
Here.
you will understand what artery is symptomatical, да? Here picture and in angiography, in this, for example, right coronary artery, you will find thrombosis, да? And you should treat this thrombosis. Понятно? Понятно. Хорошо. By location, значит, first standard lead together with first, second standard lead, V1, V2, anterior wall. Поехали дальше. V3, V4, V5, V6, AVL. Together. Lateral. Да? Third standard lead plus second plus AVF. Inferior. Plus V1, V2, posterior. This is difficult. Да? Classic. This location, posterior location is more difficult to understand. What is it in my how we can understand it? Classification by types. Да? But we have myocardium wall. Да? IMI it's necrosis of this wall, да? Of myocardium part, which oxygenated by artery. If we have block of this artery, myocardium, which was oxygenated by this artery, will give necrosis. Да? So, when we have transmural wall, it means that we have necrosis of full wall. Да? QMI, deep but not full wall. Да? When it's non-Q, it's small local problem, non-QMI, small local, and from time to time we can't differentiate it in echocardiography because it's small places only. Понятно? Next moment. ECG diagnostic of MI. Значит, tell me please, how we can describe classification of MI by stages. OQ test, да, and scarring. 4 stages. In all these stages, ECG picture should change. Don't give this to anybody, only for your group.
Yes, I do.
So, in different types of MI, transmural, Q, non-Q, different changes in ECG. Да? Значит, by stages, OQ test stage will durate how long? First 2 hours. First 2 hours. It's gold time in which you can stop development of MI in situation if your patient understood in time that something happened terrible. If he called in time to ambulance. If ambulance in time came to this patient. If doctors from ambulance understood in time what happened and hospitalized him in time. So during these 2 hours, everything during these 2 hours, hospitalized him to coronary angiography, they can stop development of MI. Да? Doctors will evacuate this stroke, will put stent there, and ECG will normalize. In Russia, it's impossible. Because our patient usually stay at home and think, oh, everything will be normal, will be okay, let's wait something. What something, I don't know. No, as a result, we have very high risk of death in this stage. Да? 60% of the patient will give death in this time, in first day, because of they stay at home and wait something. Понятно? Значит, second stage will start after 2 hours, acute stage, да, and will durate at 7 days, right?
Yes.
Long time, да? 7 days, it's long time. ECG will change during this long time. From the 8th day to 28th day, it will be subacute stage. The same ECG will change during this subacute stage. And the last one, after 28th day, it's current stage, да? Let's start it from transmural MI example. Transmural MI. Значит, in transmural MI, you saw this picture. We will have not yet. Two big part of the cat. No, it's not specific. Start of elevation, да? And very high coronary T. Да? It was this picture. The same picture will be in QMI. The same. First 2 hours, да? After that, if we tell about transmural MI, ECG will change. What changes? R wave absent, it's transmural, да? We have QS complex, and we have high ST elevation, да? T positive. Да? 7 days of the problem. First reaction, elevation. After that, ECG will try to normalize. Try to come back to the line, да? This ST will go to the line. So during 7 days, ST will try to decrease. How we can understand that we have transformation, acute to subacute stage? QS complex already present, it will be for a long time. ST elevated yet, but T goes down, да? There is a line. When T become negative, it's small, but it's already negative. Subacute stage. So QS complex present, ST elevated, T become negative. Да? Duration of this stage 20 days, right? From 8 to 28. During these days, ECG will normalize, right? How it will be? Decrease of ST and T become more deep. Понятно? In scarring stage, we will have normalization of ST. The QS complex present, it will be for many years. ST normalized, T deep negative. After long time, it can normalize to T. This picture, да? And from this moment, from 28 days, it will normalize and will be constant without any changes. Maybe another situation, transmural MI can complicate it by aneurysm. Да? Because of in this place, in this necrosis, myocardium muscle already absent, да? So here can be development of aneurysm. How we can understand it by ECG? We have start of scarring stage, but ST stay in this situation. Some about 1 millimeter elevation, but constant elevation from day to day without any dynamic in scarring stage. It's marker of aneurysm. Понятно? It's transmural MI. QMI. The same acute stage, the same picture, the same. But in acute stage, it will change. What changes it will be? Q normal yet, R normal yet. ST elevated and positive T. Вот this gets back. Да, you see, да? 7 days. What changes should be during? No, the same. Elevation. First reaction. After that, we will normalize. Not depression, normalization. So, we have development of pathological Q. R wave become more small. ST try to normalize. T positive. Понятно? Q pathological. R small. T positive. 7 days, да? Next moment, transformation to subacute stage. Оп. Понятно? ST goes down to is the line, да? T become negative. It's already subacute stage. Next moments during 20 days, ST try to normalize, да? T become more deep. Понятно? How we can understand that we have start of scarring stage, ST normalized, да? T negative. Pathological Q will be some years. Понятно? It's QMI. Last moment, non-QMI. I told you it's not specific changes, non-specific. The same may be in arterial hypertension, in myocarditis, in valve problem, dyselectrolyte disorders, million other diseases can give the same changes in ECG. So, if we tell about non-QMI, first of all, clinical picture, next, markers of necrosis, and only last variant is ECG. Понятно? Only by ECG you can't differentiate non-QMI. What changes will be if we tell about non-QMI? It's norma, да? In non-QMI we will have changes only of the last part of the complex, ST and T. What changes? Maybe only ST depression. Maybe ST depression, negative T. Maybe ST depression, negative T. Maybe plus minus T. Maybe this situation. Maybe only ST depression, but durated more than 30 minutes. Да? If we tell about angina less than 30 minutes, MI more than 30 minutes. Понятно? So, non-specific changes. So, you should know everything about your patient. Понятно?
Да.
Понятно. Хорошо. Все. About ECG, that's all.